1 in 5 girls aged 15 to 19 is already a mother or pregnant.
Our mission and vision is to provide education. People have free access to chat with an automated system, to ask any question they would want to know, but no one has access to it. I think the scientific backed research is so crucial and so important because you then can actually we adjusted WeMasomo based on the needs of the end user, on the requirements of the end user.
What would you say is maybe the one thing that gives you credibility, that makes people believe, okay, this is something that we can try, this is something that will help us? What would you say that is? Hey there, welcome to HealthBeat Africa. I'm your host, Valentine Kamau. On today's episode, we are going to be talking about sexual reproductive health and how AI is breaking down barriers to give young people access to the right information at the right time. And now, just to set the stage, let me share some very interesting numbers. According to UNFPA, Sub-Saharan Africa has one of the highest adolescent pregnancy rates in the world. 1 in 5 girls aged 15 to 19 is already a mother or pregnant. And millions still lack access to accurate, stigma-free information. Most turn to the internet, but often what they find is misleading or safe. The good news, AI is changing that. Today, I'm joined by Dr. Clarissa, who is the founder and CEO of WeMasomo, a platform using AI to deliver sexual health education that is specific to young Africans. And today, Clarissa is joining us from Germany. Clarissa, nice to have you here. Welcome.
Thank you very much for having me. It's really a pleasure to talk to you about this really important topic and how to put emphasis on an e-learning application where we could use AI on distributing education.
Amazing. So we can just start from the beginning. You can tell us about your journey, a bit of your background, your education, and what led you to create such an innovation for sexual reproductive health, such an education platform.
So we are actually focusing on healthcare topics, not only on sexual reproductive health, all topics concerning healthcare as well as vaccination, STIs, and pregnancy and menstruation issues. So my name is Clarissa, Dr. Clarissa. I'm from Germany, and I actually have a consultancy background. So I was working for one of the big four consultancy companies back in Germany, and then decided to, after having a fundraising project in northern Kenya, close to Lodwar, to focus on and put emphasis on e-learning applications in resource-constrained regions where accessibility to healthcare facilities as well as to education is limited. And I wanted to focus on adolescents, women and men, between the age of 12 to 25 on using the thing they have every day in their hand, their smartphone, to bring education towards research-constrained regions. I joined the European biggest research institute, Fraunhofer Institute for Software and System Engineering, and was able to pursue my PhD while focusing on e-learning applications and how to implement it in cross-cultural settings with the help of AI. And WeMasomo, Masomo meaning education, we for we, is the end result on the scientific research as well as the practical example on cross-cultural settings. That's where we are right now. We are available in the Google Play Store and we are an app live.
Amazing. I love that journey and how especially you're mentioning about the cross-cultural context and the focus on the young people from the ages of 12. So now if you can just take us through how the innovation came about. So now when you came to Kenya and what partners have you worked with just to implement this solution? I know you work with community health workers. So just take us through the journey of now getting the community health workers on board. What exactly how they learn about WeMasomo so that they can now go and disseminate the information. Just give us that context of the community health workers, the understanding, how they disseminate the information.
So yeah, you mentioned it completely correct. We work with community healthcare workers as we are an app, a digital app. Therefore, we are accessible free of charge for everyone. Not only our primarily target group, which are boys and girls between 12 and 25, as well as, of course, older generations, but as well our secondary target group are the community healthcare workers, on which we work or depend and work very closely with, who are distributing WeMasomo and implementing it into the communities. As our first access point to guide you through the user journey is our posters, which are our printout media, which is available in the communities and shows a QR code. And the QR code gives then the user access towards the app, to download the app or to also access it over your computer. And then they create a user profile. And the user profile then gives you access to all AI features, a WhatsApp AI, WhatsApp chatbot, language translation, to as well as training of trainer courses, which also are AI based. And those training courses have to be completed by community healthcare workers. They receive, after successful completing, a certificate. And with this certificate, with this education, the community healthcare workers goes towards the different communities in rural regions and demonstrates WeMasomo, educates with WeMasomo, and creates awareness on all healthcare topics, providing education to other young adolescents.
Amazing. I really like that first the community health workers are actually trained to understand what WeMasomo is about, because it's only when the person expected to disseminate the information is well trained, well empowered with education, the capacity building. Now they're able to actually go to the grassroots, to the last mile, and deliver this information. So thanks for that explanation. So now you've mentioned, now when the community health workers go to the communities and they're talking to this the age group, the target age group, or even people who are older, what has the feedback been like? What are they saying? How is the reception like to using such a digitally enabled platform?
So there we were very lucky, as we have been working with international cooperation partners, pharmaceutical companies, as well as different NGOs from Europe, who gave us access to the different communities they are present in Sub-Saharan Africa. And those communities who we were able to pilot WeMasomo with. So back in 2022, when we first piloted WeMasomo, we went to different regions with the initiative of Making More Health from Boehringer Ingelheim, the social initiative. And the communities gave us very valuable feedback as the tool constantly developed, as we are a very agile and very fast adapting tool, very fast adapting application. Concerning the content, for example, the strategy. So the feedback we have been receiving was, of course, very well and very accepted. That was also my scientific research on how to best have a high acceptance rate of e-learning applications, of e-learning tools in resource-constrained regions. But we constantly adapted the content concerning the health topics which are covered, as it's from region to region differently. It's also culturally different. What is actually in the interest of the user? What areas are they interested in? Are they rather interested in endometriosis or on how to get pregnant? Or is it rather on how to protect myself concerning contraceptives? Or how I want to learn more about menstruation, or capacity training courses. So we adapted the courses based only on feedback of the users, as we are constantly working with the user. Every user gives us from time to time feedback on how we can improve the content we are delivering, what additional content is needed. and how we can provide it, as we are very much gamifying the content to reach as many people as possible.
Amazing. I like the aspect of the cultural context and the different topics. So when you talk to when you get information about different users wanting to learn about a certain topic, then you focus on that. So then that brings me to another question on how do you ensure that the data you get about the privacy, the protection, the data sovereignty, how are you going about that?
Very important question. Thank you very much. So we are here very lucky to work with CMS, one of the biggest or worldwide known legal companies who supported us in the data protection law, as all data is then anonymized and concerning German privacy law, as we do not receive any data on name or on location or whatsoever. The only data we receive through the user profile is the username, which can be any, as well as the gender and the topics the person is interested in. But we do not have access to any privacy data. As well as, for example, within the WhatsApp chat pod, people have free access to chat with an automated system to ask any question they would want to know, but no one has access to it. And that's really, really important. So everything is very much anonymized.
That's amazing to know, because we need to ensure that even the AI is responsible. We're using AI in a responsible way, in an ethical way. So really nice to know that all the information that is received is anonymized. And of course, some of the topics that you are, that you're educating through your platform are very sensitive, the taboo topics of sexual and reproductive health, about early pregnancies, very taboo topics. So it's really nice that to know that all the data is anonymized. So I know you mentioned about your app, so you can access WeMasomo platform through the web platform and also the app, and we will definitely be linking this on the description box, so that anyone watching the episode can just quickly log into the your website, access the information, download the app, go and create the user profile and access all the information over there. Myself, I actually downloaded the app, so I found some really useful information, very relevant and easy to follow. So I really liked that. So about the app, can you tell us about how many users have used it? Do you have those numbers? How many people are using it?
Yeah. So we are right now, I have a user base of 8,000 users who have been established and organically growing over time. We tested the tool at the beginning with each in Lotwa, Eldoret, Nairobi, with each cohort of around 100 people, who then gave us the feedback based on what additionally is needed, and we developed it further. So since luckily our awesome freelancers who access and distribute the app, we are the personalized QR code within the app, so they receive referral WeCoins in our digital wallet within the profile, and they collect coins and then are reimbursed to our freelancers, and that's how we organically grow. We never did marketing or specific marketing on social media, and that's what I really would like to highlight here, distinguishes us from all other platforms, is because data privacy is so important and so crucial. So we do not capitalize on it. We do not use the data because data privacy is our most important value. And therefore, we never targeted social media marketing or wanted to capitalize on any privacy data. Our mission and vision is to provide education, and therefore we depend on our organic growth via our referral codes in the user profiles.
Yeah, I really like that you're really intentional on the data privacy, and really great to know that 8,000 users, that's really great now that they're coming in organically and not through any social media marketing platform. So then I know you mentioned one of the areas that you rolled this out and did the piloting is Lodwar in northern Kenya. So this area is really known for being underrepresented in terms of health technology reaching their primary health centers, not well facilitated. So really good to hear that you did some of the piloting in Lodwar. I know you also mentioned Eldoret. You also mentioned Nakuru and Nairobi. So if we can just narrow down a bit to Nairobi. I know when we were chatting earlier, you mentioned about some 3 areas in Nairobi. If you can just go into that and how that looked like.
So, I'm based in Germany, but the team is based in Nairobi or around Nairobi, as well as you primarily mentioned in Nakuru and Eldoret. So the team goes to the different communities, educates the training of trainer facilitators, the community healthcare workers, educates them with our print out materials. And then the capacity training courses are completed with an assessment. And only when you have completed the assessment and received the certificate, then you are allowed to work for WeMasomo and distribute it further to your local communities. As WeMasomo is so digital and so AI based, it can go to any different regions. So we, for example, had our first trials as well as in Tanzania, Rwanda, and Uganda with local foundations we are working with. And therefore, it's a very constant organic grow. Whoever is interested, for example, India, we thought about, or South America, whoever is interested in working with WeMasomo can log into the website and then actually get the materials, the education material, and educate their own community healthcare workers and then distribute it in their local communities. So that's why we are very organically and independent, so to speak. And concerning Nairobi, we went to, for example, Soweto or Kibera and worked there with several different community centers who make use of WeMasomo as it's free of charge. They don't need any additional material, so it's very cost sensitive, or it does not cost anything. So the only time sort of is needed by the community healthcare workers. That's how we grow.
I really like that explanation, especially narrowing down to Kibera and Soweto. Those are some very under-resourced areas within the Nairobi city. So really good to know that this innovation will actually get down to the people who really need it the most. And I also really like expanding to other African countries, Uganda, Tanzania, and even you've mentioned India. So this will actually be a global innovation, just educating people at the touch of your phone. So really, really amazing. So now I would just like you to highlight. I know you've really gotten accolades and mentions from different partners. So maybe if you can, mention these awards you've gotten and, just to highlight that.
So we wouldn't be here where we are right now is not if we would not have gotten great support by several different partners and who provided us access to the different communities. We have been working greatly with women, innovation and technology, as well as with different stakeholders from the government who support e-learning application, who support free access to education and share our mission of just providing education free of charge without capitalizing on the people and on the needs of the actual target group of the actual user who are willing to learn, who are willing to contribute, and who are willing to receive certification without maybe needing to finish university or having a finished high school degree. So we worked with different foundations from Germany, as well as being greatly supported also by the Ministry of Economics in Germany, as well as local initiatives and some politicians from the Kenyan government who mentor us, as well as different international organizations in Kenya. And we are looking very much forward to actually deepen the relationship, as we would very much love to work even closer with the Kenyan government, providing and supporting free education, especially in the healthcare sector, with the current international situation concerning international organizations to actually reducing their support. And that's why I think WeMasomo could be a great fit, as it's digital, it does not cost anything, and it's very, very scalable.
Great. That's really good. I really like the idea of scalability, because scalability is usually closely linked to sustainability. So I like the mention of also working with the different government partners, development partners, and, private sector also. So that's really good. And I know we actually first met when you were in Nairobi at that Women in Technology and Innovation Summit, where you actually signed an MOU. So maybe just highlight that a bit, and then we'll just move on.
Yeah, so we have a lot of MOUs with different organizations, and we are always very much keen on establishing additional MOUs with the government and the Kenyan Institute for Curriculum Development or other organizations. Would very much be interested in. We already have some with different local organizations who support us in the implementation process of WeMasomo, who support our awareness campaigns and support us, giving us access to different schools, to community centers, as we are just an e-learning application wanting to add on the already existing infrastructure and the already local presence of local organizations who provide education. And we are the counterpart for all health-related topics. And that's why we have different MOUs with, different organizations. And the conference where we, for example, met, I gave I was part of two panel discussions focusing exactly on AI and healthcare. And it's very much, we want to work with those organizations to create awareness, to bring the WeMasomo out there. And let's use the tool because it's already out there. So.
Okay, great. I really like that explanation. So partnerships are really key in, just making the platform more more known by different users. I like to say that collaboration is the new innovation. So different partners bring in different aspects, just to empower everything that you're doing. So then now that brings me to something. Now that you have set up WeMasomo, I'm sure there are maybe some challenges you faced in terms of funding, in terms of getting the right people to work with you. So if you can just get into that, some challenges of the setting it up, getting the right people to understand your vision and to actually now implement it. What challenges have you faced?
So at the beginning, it was very, very flowy and very easy to get supporters on such an important topic, as we were focusing on pregnancy education, on menstruation, and on contraceptives. And now we extended our knowledge base on vaccination, on cancer prevention measurements, on nutrition and family planning issues, as well as on education with a child and the training of trainer, the capacity training courses, which are now our main pillar, and how we distribute it. So our biggest challenge was actually setting up the right team, the local team, because I'm based in Germany, but the team is based in Kenya and fully local. So getting the right developers, getting the right people on board who share the vision, because we are a non-profit organization. We our mission and vision is our main priority. And therefore, we wanted to focus on that and getting people on board to believe in the same mission and vision. This was some of the struggles, but to be honest, we actually managed that quite well. And we also had a lot of supporters, and we're always very, very lucky. Funding-wise, this was a very interesting journey. Where we were struggling concerning the distribution of, for example, sanitary towels. We were donated a lot of sanitary towels to the people or to us, which we could then distribute to different communities, to different schools, but getting them to the schools and having access to the schools was at the beginning a bit of a struggle, and having access to public schools. So there we are in need of support by the government, who give us and provide us access to the public community healthcare centers and the public schools. The private ones is not an issue, but the public ones, so working with the public ones, it was a bit bit of a struggle.
Okay, I hear you. There's a bit of a challenge getting the public partners on board. It's always easier sometimes, not all the times with private sector, but I know you'll get there. The persistence that you've had getting all these partners on board, and what's the one thing you would say has helped you? The one thing that has given you credibility to even get access to these places that you already have access and are rolling out, what would you say is maybe the one thing that gives you credibility, that makes people believe, okay, this is something that we can try, this is something that will help us? What would you say that is?
So I believe the biggest credibility we have are the partners we have on board, as we have a very, very, very strong reference and partner organizations who believe in us, who have very high credibility on their own. So therefore, we had quite, we were quite lucky to then get backed by them and get supported by them. Just saying it's a good product, it's reasonable, it's scientifically based. So all the research I have done and I have completed went into WeMasomo, in the development of WeMasomo. So it's not some nice idea. It's actually scientifically proven that this e-learning application works and has its success based on the progress we are making and how we are proceeding, as well as our partners, the scientific research and the persistence on how we are processing, as well as, of course, that we are an NGO. So the local team has a salary, but they are the only ones who receive a salary, and based on the awesome work they're doing. But we do this for the mission and vision, but we do this not for profitability and actually taking advantage. And this is what distinguishes us from the rest, as we do not capitalize on the training and the training of trainer courses and the capacity training building courses.
Amazing. That's really great, Clarissa. I like the aspect of it's scientifically based. It's research. It's backed by data. So I'm sure that really gives the credibility. It's data driven and everything. And all the partners you have on board, I'm sure that also gives you great credibility. So now, as we are also just starting to move towards the close of the episode, I would like you to just share what's your vision. I know earlier you alluded to the mission and vision and what sets you apart, but say within even the next 3 to 5 years, what do you see about scale, the sustainability? I know you already mentioned about some countries that you have already done some piloting in, but if you could just share that,
So as we are available in actually every language, thanks to AI, we are, the piloting phase in Kenya has been completed. We have access, we have created a certain user base, but now we are looking to actually get it to across sub-Saharan Africa and then maybe across Africa. providing the healthcare education, which is in some areas needed to empower, to educate, and in alignment with the SDG goal 3, 4, and 5, providing good education, providing equality, and providing good access to healthcare. So we are thinking about the next 3 years expanding across Africa. We already have tested it in South Africa, Rwanda, and Tanzania, and then also establishing a strong partnership with local organizations in India.
Oh, that's really great. I know you've mentioned about the languages. So can you maybe share a bit of the languages that this is already working?
So we started with Swahili, Hindu, Arabic, French, Spanish, English, and German. These were the languages we have translated everything with audio files for people who are not able to read and write, as well as the audio files and Linda and Leo, our fictional characters who guide the user through a very gamified way through the application. So they spoke those languages, but now thanks to AI and our Google credits and the support we received from Google for the next 2 years, we are now able to actually providing the application in every language available, as well as all African languages, so we can really adjust it to the content and to the different cultural needs.
I like that language aspect because that means it will get to the targeted user in the language that they understand, in the context that they are, so they understand it in their own way, and just empowers them in a really powerful way. Amazing. So now that you're the health expert here on the education platform, your innovation, I would like you to just demystify some things. Now in this AI movement era, there's a lot of things that are said. AI, is it fact or fiction? So I'll just read out a few statements and then you'll tell us, is it fact or fiction, based on your expertise and, just a bit of an explanation about that. So going fast, AI alone can deliver effective sexual health education or any other health education without human involvement. Is that fact or fiction?
Fact. This is a fact because providing the first access, the first education, you don't need the human interaction. And because sexual reproductive health education is so highly stigmatized, this is where we come in to unstigmatize it, to culturally sensitive education providing. That's what we do. You can do this over AI to provide it culturally adapted to the needs of the actual user.
So that is a fact. It's faster and it's the first point of contact.
Yes.
Great. So next up, most AI health education tools today are not designed with African youth in mind. Fact or fiction?
100% fact. Because sadly, in a lot of other medical research aspects, the African communities were not really considered in the research and in the development process. And that's why I think the scientific backed research is so crucial and so important, because you then can actually, we adjusted WeMasomo based on the needs of the end user, on the requirements of the end user.
Great. So next, AI can be trained to understand cultural sensitivity, taboos, and local language nuances. Is that a fact or a fiction?
Sorry, could you repeat it again?
AI can be trained to understand cultural sensitivity and local language nuances.
I think it can, but it still takes time. And it's important that all across the world, across the across all continents, all people take part of it, and in a very ethical and moral correct way, because there are also a lot of misconceptions and misinformation on the internet, especially on AI, especially on ChatGPT, whatever. So that's why tools like WeMasomo have to come in to then justify the content and actually correct the content which is out there, because there's so many misinformations. So all the content needs to be, before putting it out there, especially in such a highly stigmatized area, to verify the content on its actual medical correctness.
Yeah. That's really great to hear about the credibility and, destigmatizing the information and there's so much information going around it. So
and
now,
verifying the content, because there's a lot of false information in the internet.
yeah. So WeMasomo is just an innovation platform that is right on time with the misinformation that is really everywhere at the touch of your smartphone, at the touch of your laptop. It's everywhere. So really great to hear about that. So now, as we just final segment is about an African proverb. So one of the things that I'm really doing with this podcast is tying everything about the AI health movement to our cultural context, so that these AI health innovations are actually specific for Africa. And one of the things we are known for is, the wise sayings from our ancestors, so the proverbs. So there's one proverb that I'll read, and then you can just tell me your understanding of it, and in terms of WeMasomo, how is this relevant for the African context? So here we go. Wisdom is like a baobab tree. No one individual can embrace it. This is a proverb from Ghana.
Well, I believe it's actually quite true, because we are all human. We are constantly developing, learning, and we never know the final result. We are just trying our best, but everyone, I think, has to do their best, and creating impact and creating awareness, contributing to the community, and being a nice human being.
Yeah, I really like your explanation. So it's about the wisdom and, what actually WeMasomo is doing is actually just disseminating this information, and even all the partners that you mentioned you're working with. So no one person has actually all this information. You might be the expert in the research you've done, but then you actually now need the different partners. You need the community health workers to disseminate all this, to get down to the people who actually need this innovation, who we are trying to empower at the last mile. So really amazing. So just to wrap this up, you can tell us, where people can follow you on your socials, and then just a final closing word from you.
Well, WeMasomo can also only just grow by the user, who are the experts on knowing what they would like to learn, and experts, so to speak, in the what they don't know and what they would like to get to know or deepen their knowledge in. So I think it's on all levels. We are all just trying our best, and some are providing resources to learn, some are using it, but can also provide their knowledge on different areas. So I think everyone is working together and communally to create a better world. So thank you very much. You can download WeMasomo in the Google Play Store for all Android phones. The iOS app is coming soon, and as well as over the web app, of course, or website to your browser. Please feel free to connect with us on Instagram, Facebook, as well as on LinkedIn. And if you have any questions, you can always reach out to me.
Yeah, Amazing. Thanks for sharing that, Clarissa. It's really been great, just talking to you, learning more about WeMasomo, and looking forward to connecting when you're back in Nairobi. And thank you for all you're doing. So that's it for today's episode. Thank you for watching. If you've come this far, please like, share, and subscribe. Also, just follow us on all our social media platforms. And I'll see you on the next episode. Bye for now.